Max Wardell, overheadathletics.com. We actually have a couple tight ankles here, and we've done some talar curl mobilizations. We've actually done some subtalar mobilizations for eversion. We've actually used a massage gun, worked on a little bit of tone here in the gastroaxilleus complex with some good success. And it's interesting, you can actually feel the heat coming off the calf complex here compared to the upper thigh. But what we're actually looking at now is, now that we've done that stuff and we've kind of improved this range of motion, the quality of this range of motion, what we see is that this skin here and this subcutaneous tissue is pretty tacked down over the Achilles, over that heel cord, and it doesn't seem to move. And actually, when we kind of just give it a little impulse this way, we can actually see how it proliferates up into the calf, that impulse. And this one, a little bit better on this side, but towards that medial aspect of the insertion is tight, as well as over here, we don't see a lot of skin and subcutaneous gliding, which is something that we need, because as the ankle goes through its motion, you want to eliminate or limit the tension on as many soft tissue structures as possible. So that's what we're going to kind of look at in this video. So for the purpose of the video, we're going to show you on this right lower extremity, and you can see just by doing that how limited dorsiflexion range of motion truly is, and a lot of that is soft tissue implication on the posterior side. So when we look at this, the first thing we're going to do is we're just going to pin and tack. So what I'm doing is I'm actively dorsiflexing while I am compressing in a proximal direction the tissues on the Achilles here. Like I said, we've already done some soft tissue mobilization of the actual musculature, and now we're coming down here into the heel cord complex. And what I'm doing is I'm using the radial side of my index finger as well as my thumb here, and I'm actually kind of pulling posteriorly as well as cranially as I apply my dorsiflexion movement. And it's not particularly comfortable, but we have to start. And you can see already that that tissue actually moves over the underlying muscle. And it doesn't want to come up a lot, especially on the posterior side of that, and then on the actual medial side of the, and I can use my leg too, kind of do two thumbs. This one's a little more intense sometimes. I use my two thumbs and I'm compressing and pressing cranially, and then I'm actually going to pop over here, and I know I'm kind of blocking the view on the video, but I'm going to push caudally or towards the plantar side of the foot while I do this insertional portion. And I'm taking the foot into an externally rotated position at the same time to maximally lengthen those structures on the inside there. And so I'm not using any gel. I'm trying not to glide over the skin. I'm trying to hold the skin and then move the portion of the leg. So when I tack it down, I'm preventing it from moving, but I'm requiring that the tissues underneath move because I'm taking the joint through a range of motion. And it's actually a lot better in terms of pure ankle range of motion already. From there, I can follow up with a little tool massage or a little bit of instrument-assisted soft tissue mobilization. There's a lot of theories about it, but it's a great little follow-up after something like that. Puts a little lotion on the skin and kind of allows it to be moisturized at the same time. I can do movement and massage. A lot of times at this point, I'm just going to pull caudally, stabilize the foot or counter pressure on the foot with my thigh here. And I'm just going to kind of glide back and forth. And then when I get to those lateral and medial portions where the bones kind of are, I'm going to kind of use a little scooping or cupping technique. And as you can see, I'm using the more diffuse beveled side to start. Not comfortable, but we're trying to kind of loosen up these tissues on the posterior side of the ankle, and then I can go cranially and use the more focal contact area. And it doesn't take a lot of force to elicit what you want. And then I can always come up into the calf, give the patient, the athlete, a little break, come up into the calf, do some soft tissue mobilization up more proximally. And then I can kind of, now it's going to be tougher to actually move the skin because it's got some moisture on it, but I can actually move the ankle and see if I've improved the quality or the quantity of range of motion. So, perfect. Give that a try. Make sure the sub-Q moves as well as the skin tissue. Take it through inversion, eversion at the same time. If you're new to the channel, make sure to subscribe and like this video. And also check me out on LinkedIn, Max Wardell on LinkedIn.